update.
Can everybody hear me?
And you did, correct?
I want to sincerely thank you for taking the interest and the time to come to my office. I'm a family doctor who's been caring for patients in my small, independently run practice for almost 17 years. The doctor-patient relationship is the cornerstone of what I believe makes U.S. healthcare the best in the world. But that relationship is being severely threatened. I feel so privileged to have the opportunity to fight back for my patients and to tell you why, in my professional opinion, Pat Toomey is the right person to send to the United States Senate. He, I believe, is committed to restoring that doctor-patient relationship once again. The patient doesn't know it, but we're not in the exam room alone anymore. The two of us are under tremendous time and effort constraints because others have inserted themselves between us. We have Medicare, Medicaid setting the pace for insurance companies, telling the patient and I what tests and medicines can be ordered. These daily appeals for patient care are often decided by a nameless person, usually who has no medical background. We also have the trial lawyer in the room, ready to recruit my patient into being their plaintiff, if there ever is a bad outcome. Quite sadly, I report to you that every decision I make, with every patient I see, I practice defensive medicine. I have been forced to unnecessarily frighten patients and expose them to what I feel is unnecessary testing and even treatment, while wasting limited financial resources and time because of my own liability fears. This is because I've been taught by the current system that I must prevent a lawsuit against my medical license at all costs. Merely being named in a lawsuit can have devastating effects for me as a doctor. A lawsuit has the power to zap my energy away from caring for the patient that's right in front of me. It has the power to indelibly jade my medical judgment, to make me question my own abilities. It has the power to potentially ruin my patient's trust in me and publicly ruin my reputation. And probably most importantly, it wastes precious time away from my patients to be with lawyers to defend myself. I know this is true because that's what happened when I was sued. I was erroneously named in a lawsuit for an alleged act that a ER doctor performed. My lawyer said that the lawsuit, which was fairly standard, and I shouldn't take it personally. However, it alleged things that fly in the face of the Hippocratic oath that I took when I became a doctor. For that reason, I, for one, failed not to take it personally. It took 2 years before a judge finally dismissed me from the case, but not before the damage was done for my doctor-patient relationships, and it's been hard to come back from that. Not to mention the financial cost of a lawsuit. Given that, I do not want to limit anyone's right to sue. But there are more efficient ways to get deserved compensation to the truly injured without all this collateral damage to the healthcare system. These days I spend less time than ever in the exam room with my patients. Only about half the time of my 60 to 70 hour work week is spent directly with a patient. The other 50% of my day is spent not practicing medicine, but doing things I was never taught in medical school, like trying to keep my small business going. That means I have to persevere through piles of billing paperwork to get paid for the care I've delivered. So why am I here in support of Pat Toomey? Pat Toomey cared enough to ask what I felt were the obstacles to better health care policy, and what ideas I have on a grassroots level to restoring that doctor-patient relationship. He took the time to educate himself in the complexities of healthcare delivery. He knows that the National Healthcare Reform Law fails to serve the doctor-patient relationship. I attempted to reach my current congressman, Joe Sestak, during the healthcare debate last year, but he failed to respond to more than a dozen requests to speak with me and my colleagues while I was the then sitting president of the Delaware County Medical Society. I've spoken to Pat, and he gets it. He believes the very things that physicians and patients have told me that are great alternative solutions to a lot of the problems with healthcare. I've come to believe that he is my patient's best chance of restoring that doctor-patient relationship. And with that, I'd like to turn your attention over to Dr. Richard Schott for an opportunity to speak further.
Good afternoon. I'm Richard Schott. I'm a cardiologist practicing at Riddle Memorial Hospital and also at Crozier Chester Medical Center in Upland, Pennsylvania. I'm a trustee on the board of our Pennsylvania Medical Society, representing 6 of our southeastern counties, and I serve on the executive committee as finance committee chair. I will be running for vice president at our October meeting of our Pennsylvania Medical Society House of Delegates. I am also a PA delegate to the AMA, and I have helped to formulate and support our excellent AMA policies on healthcare reform. But, along with a large number of my fellow delegates, I'm extremely disappointed with and have openly opposed our AMA leadership's misguided politicization and of our policy and with their support of Obamacare. Unlike what we have observed in President Obama, Congressman Toomey will work to repeal the current health care legislation and replace it with common sense reforms that will allow us to provide quality care to our patients. I am honored to be here to pledge my personal support to Congressman Pat Toomey's candidacy for the U.S. Senate. He is committed to fiscal responsibility, including a reduction of our out-of-control government spending. He believes in free enterprise system and has earned the endorsement of our Chamber of Commerce. Congressman Toomey has been proven to be a true friend of medicine. Unlike the Obama, Reid, Pelosi, and yes, Sestak philosophy of bigger government with more controls, more regulations that will further intrude on our practices, Pat Toomey is committed to the reduction of these ever-increasing intrusive government regulations. He favors improving access to our patients and supports reform at the national level that have been proven successful in states such as California and Texas, including a $250,000 cap on pain and suffering in medical liability cases. Unlike his opposition, he has proven record of accessibility and seeks and respects our input on medical issues. He will honor his office with his personal integrity, and that is badly needed to restore public confidence in Washington. It's my pleasure to now introduce Dr. John Hewitt. Dr. Hewitt is a internal primary care physician and gerontologist. John? Yeah.
My name is John Hewitt, and I'm a family doctor. I've lived in Delaware County my entire life, and for nearly 30 years I've practiced in Alden, in the neighborhood where I grew up, and I've had a wonderful career in primary care. I regret more younger doctors are not doing it. And my staff complains that this is the first time in a long time that I've taken any time off. I've canceled hours today to come here and express my appreciation and gratitude to Pat Toomey, and to let everybody knows who takes health care seriously that we need Pat's election in the fall to repudiate Obamacare. Now, the contrast in this election is going to be very stark. The difference between Joe Sestak and Pat Toomey is huge. Joe Sestak voted for a massive government intrusion into health care, 2,400 pages of red tape for doctors and physicians. It's going to abridge the freedoms of doctors and physicians for the foreseeable future. Joe claims he read the whole thing, and I am very skeptical about that. But if he did read the whole thing, he missed the part how disastrous it will be for Delaware County. Some of our biggest demographics in Delaware County are young working families and the frail elderly, and this bill hits them especially hard. And worse still, the bill for all of this is going to be passed on to our grandchildren. Now again, with Pat Toomey though, Pat Toomey would never agree to such a massive intrusion into the doctor-patient relationship. He believes in economic freedom, as I do. And he thinks that with his ideas, the patients will have more choices, which will lead to happier patients, and yes, happier doctors. So again, I canceled hours today, which is kind of an unusual thing, but I wanted to make sure that my colleagues and my patients of 30 years know of my ardent support of Pat Toomey, and we need his election in the fall to repudiate Joe Sestak and Obamacare.
Well, first of all, let me say thank you very much to everybody who's here. Dr. DeMario, thank you for hosting this. I appreciate that very much. Thank you for your leadership in this, and thank you for, I think, a very powerful case that you made about the centrality of the doctor-patient relationship to the quality of health care. I couldn't agree more, but you've got the experience, and I appreciate that. I also should point out that you are a current or a recently past president of the Delaware County Medical Society?
Past president, recent past president,
Right.
yes.
And I think that's important because it's clear evidence that not only are you relying on the years of experience you've got with your own patients in your own practice, but you've also taken a leadership role with physicians within the physician community, and that's an indication of the knowledge you have of other practices and the respect that other physicians have for you. So thank you for your thoughts and for your input. Dr. Schott, another past president, I believe, of the Delaware County Medical Society. So again, another example of somebody who has not only the firsthand personal knowledge and experience of treating patients, but also that of his colleagues who chose to elect him as a president of this society. I appreciate your thoughts on the importance of less government regulation and common sense tort reform. And Dr. Hewitt, thank you very much for underscoring the nightmare that a multi-thousand page healthcare bill inevitably is. The unintended consequences, most of which are going to be very negative, that come from this huge, huge expansion of the power of government. And thanks to everybody who's here. I just really appreciate your support. I appreciate your input, and I value your advice. I'm a former small business owner, and I know a lot about the little business that I ran, but I couldn't possibly know as much about your business as you do. So I really value the input, the advice, and the guidance that you can provide in my efforts to help make sure that the legislation that we end up passing is as good as it can be. Let me just say a few things about this bill. There's an awful lot that I could say, but in the interest of time, I'm going to zero in on three topics. But first, I think this bill, the Obamacare bill that Joe Sestak supported, it's another example of Washington overpromising and under-delivering in a big way. I mean, they did it with the stimulus bill. Remember, Joe Sestak and his colleagues told us that if they passed that giant stimulus bill, the unemployment rate would never go over 8%. Promptly went to nearly 10%, and it's above 9% today. This phenomenon is very much the case in this health care bill as well. Let's consider a few things. First, they said this is going to reduce the cost of health care. This was a central selling point in this bill, and it's completely untrue. Even the Congressional Budget Office has had to revise their cost projections for the bill itself, and they've had to acknowledge that the bill was sold under false pretenses and is in fact going to cost American taxpayers at least $115 billion more than it was represented to cost. In addition, the Congressional Budget Office, the Centers for Medicare and Medicaid Services, the government agency that administers those programs, Health and Human Services, they have all agreed separately that as a result of this bill, healthcare costs will rise. CBO, for instance, has acknowledged that young adults in particular will be forced to pay somewhere between 10 and 13% higher premiums for their insurance as a result of the bill, higher than they would pay without the bill. So clearly, the claim that this bill is going to reduce cost is simply false. It's an extremely expensive bill that's actually going to drive up the cost of health care. There's another thing that they said. They said repeatedly, and I heard Joe Sestak say this many times, including when I debated him on this very bill. He said, a great thing about this bill is you'll be able to keep your health care coverage, the one that you have now. You can keep it under this bill. Well, unfortunately, the federal government has now acknowledged that that's not true. In fact, the CBO is estimating over the next 10 years, 9 million Americans will lose the health insurance coverage that they have now. CMS, the Center for Medicare and Medicaid Services, estimates that 14 million people will lose the employer coverage they have now. between now and 2019. And especially what is going to happen is that small companies are going to terminate the policies that they have because they can't afford the new mandates imposed by this bill, many of which we haven't seen the details of yet, because that awaits the hiring of the bureaucrats who are going to decide what those mandates are. But we know they will be many. Some are already codified. They will be expensive. Doug Holtz-Eakin, an economist, a well-recognized economist, believes that this bill will encourage employers to drop large numbers of covered workers simply because it'll be cheaper to pay the fine rather than pay the added cost that they'll have to incur. Finally, and this is a big point in Pennsylvania, Health and Human Services estimates that the cuts to Medicare Advantage, which is a very popular plan that many Pennsylvania seniors participate in, they could diminish enrollment by 50%. 50%. The last point I would make is they claimed about this bill and throughout Joe Sestak's term in Congress and the President's term thus far, that there will be no tax increases on middle-class Americans and small businesses. This is just blatantly untrue, and flagrantly so, and with multiple examples. The Joint Committee on Taxation, which is a bipartisan joint congressional committee of House and Senate members, their staff has estimated that middle-class taxpayers will pay $3.9 billion more in taxes in 2019 alone as a result of this bill. The CMS has calculated and confirmed that the medical device tax, which is going to be imposed on all kinds of medical devices, most of that's simply going to be passed on to consumers. That which isn't could very well result in layoffs and fewer jobs in the many businesses that are in the business of making medical devices, whether it's prosthetic limbs or pacemakers or wheelchairs. And by the way, there's a lot of Pennsylvania businesses that are in that very industry. B. Braun in Lehigh County, Armory Medical Associates up in Wilkes-Barre, Pride Mobility in Exeter, Orashore Technologies in Bethlehem, just to name a very, very few of the many hundreds of firms that are in this business. So I think this bill is a disaster for Pennsylvania patients. I think it will intrude on that sacred relationship between doctors and patients, because a big part of this is to have the government get to decide the nature and the type of services that will be provided. Instead of this bill, we should have taken a different approach altogether, an approach that would empower patients, that would help to restore the relationship of the patient and the doctor, that would tend to remove from the room the bureaucrat, the government official or the insurance company bureaucrat that intrudes now. I'll suggest 4 or 5 things that I have said all along we ought to do and we still should do. First, we ought to eliminate the very strange feature in our tax code, the asymmetry that allows employers to deduct the cost of health care, but workers cannot. That's the law of the land, has been, and it's a big problem. It makes health insurance much more expensive for any individual who has to buy it on his own or her own, because he or she cannot get the same tax deduction that an employer gets. This makes no sense. We should eliminate that inconsistency, and if we did so, every individual who has to go out and buy his or her own health insurance would find it less expensive right out of the blocks. The second thing we ought to do is we should not tolerate the current system whereby we create cartels for insurance companies. I mean, we wonder why people are not satisfied with the service they get from insurance companies, but we're the ones, we, through the government, create a system where they don't have to compete for our business. And then we're surprised? What other industry do we have this phenomenon? I can't think of one. So I think we should force the insurance companies to earn our business by competition, by providing good quality service at reasonable prices. That can only result in consumers, patients, having more choices and lower costs. A third thing that I think we all agree, we need some tort reform. We have an excessively litigious society. It's manifested most egregiously in healthcare, and this drives up the cost of healthcare in so many ways. Dr. DeMario explained it well. It's not just the direct cost of litigation and medical malpractice insurance. It's the hidden, embedded cost of practicing defensive medicine. This is a huge problem and a huge cost. 2 other things that would only help: association health plans, where you allow people to pool together, not based only on their employment, but based on any other association they might have, a community group they may belong to, a service organization, a church, any number of associations that would allow them to pool their numbers and buy health insurance more affordably. Also medical savings accounts. a device that really helps to restore the relationship of the patient and the consumer and pushes the middleman and the bureaucrat out of the picture so that the relationship goes back to that of the doctor and the patient. These are the things that we could do, and they would, without a doubt, lower costs, improve access, could only help the quality of health care by restoring the relationship between the patient and the doctor. It wouldn't bust our budget. It doesn't raise taxes, doesn't destroy jobs. This is the alternative that we need. That's why I support repeal of this current bill and replacing it with these kinds of reforms that will lower costs and improve access. Joe Sestak's approach is always more government. It's more taxes, more spending, more borrowing, more government control. That, we're already on the road to higher costs, lower quality, higher taxes, and fewer jobs. And that's a big mistake. But I just want to thank you again for being here today. Thanks for your input. Thank you for your support. And I look forward to working with you as your senator.
Thank you.
Any questions from the press? We covered everything.
Good job.
All right. Well, thank you all very much. Thanks for hosting this. Thanks for coming.
I just want to make a quick acknowledgement to Donna Ravito, who has done so much to make this happen, and for all her hard work for trying to restore quality of health care in Pennsylvania. Thank you so much, Donna.
And as long as Maria was kind enough to acknowledge what I'm trying to do, I am working with the campaign to help coordinate doctors for Toomey. And what we need from all of you so that we can send Pat to the Senate next year is that you need to understand that your patients do respect you. You do have an amazing amount of credibility with them. And if each of you takes just a moment to talk to your patients about supporting Pat, because he supports the doctor-patient relationship, that will have a huge impact at the polls. We'll be getting materials together. I will be making sure that each of you obtain those materials for your offices. And if you can help us by simply using the power of your credibility and the power of your waiting rooms to reach out to your patients with why we need their help to support Pat, that'll make a huge difference, and it may actually just push us over the top. So thank you all very much for taking time out of your ridiculously busy schedules to be here. We appreciate it.
Thanks, Donna.
Thank you.
Thank you very much. Thanks for coming. Appreciate it.
Thank you. It's very nice to meet you.
Likewise. Thank you.
So nice to meet you.
Thanks again.
Just wait.
All right.
Yeah.
I may ask you to tell your stories.